received?
We received a total of 10,000 dosages on our first distribution for the city of Evanston. We've already given out about 6,000 dosages through our school-based clinics, and so we expect to have about 1,200 dosages today. When we receive another distribution of vaccine, we're going to organize another community clinic in the local area. We're not sure if it's going to be here at ETHS. We may select another site that has the capacity to serve a large volume of people, but we want to make sure that we provide access to all, so we may have a separate location for the community.
Okay. Now today's clinic is for a specific group of people.
That is correct.
Take me through these.
Sure. Centers for Disease Control is real specific about the target population, and currently that is pregnant women, that is children between the ages of 6 months and 24 years of age. It is parents or caretakers of children less than 6 months of age, and it's for people that are anywhere between the ages of 24 and 64 with underlying medical conditions.
Okay.
And that's real specific for the priority groups. And then we anticipate getting more vaccine and allowing others who desire vaccine that fall out of that window of priority, but that's as vaccine becomes available.
Okay. Now, take me through the process of receiving the vaccine. How does that work?
Well, we have a triage area where we kind of evaluate whether or not the candidate is in the priority group. We assure that they are residents of the area, and then they fill out a very thorough consent form, understanding what the vaccine is comprised of, whether it's an activated vaccine or whether it's a live vaccine. And then after they sign the consent form, get a HIPAA form and a vaccine information sheet, and we're sure that they understand the vaccine that they're receiving. And they come in and see a vaccinator and they get their medication. And then we watch them for 15 minutes to assure that they're fine. H1N1 or the virus is here. It's been here since April. We have many people that are compromised by it, but the recovery is quick, and children tend to be out of school a day or two. Really? Healthcare workers and people who are compromised are usually home a day or two, and we're encouraging people to return to their normal functions if they're fever-free for 24 hours without the use of antipyretics, which are medications fever-reducing. And so typically people recovering, we haven't had reports of people compromised more than 3 or 4 days, and it's safe, and we know it's effective. We have been ready for this for a long period of time. Primarily, we've gone through an entire week of school-based clinics without problems, without major concerns, and so this is a redundant kind of habitual nature for us, because we planned it. Now the words come off the paper, and this is action.
Yeah, this is great.
It's so important that people are real conscious of their hygiene. We encourage people to wash your hands, cover your cough, and literally cover your cough with your hand or tissue and dispose of it, or cough into your sleeve. And we're really encouraging people to contain themselves. When you're sick, stay home from work, stay home from school. And we know that those simple measures will prevent the further transmission of like this.
Okay, so you heard it here, stay home from work if you don't feel well.
Stay home from work if you don't feel well.
That's on the record for my boss.
That is on the record. Stay home from school if you're not feeling well, to recover. And then, of course, wash your hands, soap and water, and cover your cough.